All right, can I come in quickly, please? So,
yes.
All right. Okay. So, Empress, thank you very much so far. I would like you to bring it home for us, because for us, and we can't play the ostrich here. When we talk about mental health, the big elephant in the room, ganja, marijuana, our association with it, and the common thought in Ghana, especially, that it has something to do with mental health. I think it's something that we can and need to address in this discussion. If you could lead the way in that direction, later on we can also chime in on that. Thank you.
Thank you, Rasquesi. For me, as a scholar in mental health, marijuana has been the least of the worries of psychiatrists in treatment centers. I worked in a psychiatric hospital for 2 years, and I had the opportunity to sit down in conferences with a psychiatrist, the people that treat mental illness, the doctors that treat mental illness. In those rooms, when we had the conferences, they told us that marijuana didn't cause mental illness, and the patients there that come for marijuana treatment were the least of their concern. They didn't actually treat them. They don't treat people that come from marijuana. Like when somebody say, they are experiencing some crisis, or they feel like they took marijuana and they should go for treatment. Your job can say go for treatment, right? So if you understand what I'm saying, Rasquesi, in the mental health hospital, they treat substance abuse, okay? So some jobs will test you for a substance, right? And they will find that you took marijuana, but they don't want to dismiss you or sack you, so they'll tell you to go to the psychiatric hospital for treatment, okay? So we have a center there for addictions. But when they come, they don't get a treatment. Those that get a treatment are those that are alcoholics, those that take cocaine, crack, and other drugs. The marijuana people, they just let them walk around there for 1 week and then they dismiss them. I guess Rasquesi is laughing. I guess they can't go and tell your employer that we are not concerned about this. They need your money. The insurance have to pay them. They have to keep you there, but they don't treat you. I work there and I work closely with the patients. So for your information, that's what the doctors said verbally in the meeting, in the conference, right? They didn't care to treat people with marijuana. Also, when I was in school taking classes for health science, the topic of marijuana came up. And it was a debate. So the class was divided, those for and those against. So for those for had a lot of books that were written by medical doctors for marijuana, okay, arguing for marijuana for the treatment. So that's my experience. In the mental hospital, one time they brought a young white boy. I mean, like pure white boy. And this boy came, and he was rude and defiant to all the staff. And I was working at night, so he was admitted at night. Then I came on duty. So when I came on duty, they assigned the boy to me. And I came to work, I had dreadlocks, right? The boy didn't listen to anybody. He didn't want to work with anybody. But when I came, I don't know why, this is a white boy, he took a liking to me, was attached to me. And so when all the patients had gone to sleep, they told him to go to sleep. He won't sleep. And he's pacing around. My duty was to make sure everybody's in good hands. So he would come to me and he said, Miss, can I get some weed? And I was like, how is this guy associating me with weed? With here, marijuana, they call it weed. So how come he's associated me with it? But he became like, he liked me so much. And he wanted weed from me. And I told him, I don't know what he's talking about. I had to pretend because I'm in the establishment. And I'm not to condone it. So I told him that I don't know what he's talking about. He said, Miss, I know you're lying. I know you know. But that kind of created a bonding experience with me and this white youth. And you can't tell him anything. He won't do it, except if I tell him. If I tell him to go to sleep, if I tell him to go and bathe or whatever. But he came for marijuana use. That was one example. His parents thought he had used marijuana and he needed treatment. And so he was angry about that. That's why he was being defiant. But again, like I said, he wasn't being treated. They just let him to walk around there, let the marijuana get out of his system, and then they dismiss him. So for your answer, here it's divided, right? They are even legalizing marijuana. I know some family members in Detroit who have marijuana card. They can grow marijuana in their house for their personal use, for medicine. The doctor gave them marijuana card for them to be able to use. So there's no scientific proof that marijuana makes you crazy or marijuana makes you have a mental illness. There's no scientific proof for that. The only thing I would say is that just as food, water, and drink and stuff like that, some things are not good for everybody's chemical makeup. Okay, even some food is not good for your chemical makeup. So this is an individual thing. If you know that you're taking it and it's not helping you, then you don't have to force yourself to take it. But you should be realistic with yourself and know that, whenever I take marijuana, me sometimes when I smoke it, I realize that I'm lethargic. I've smoked so much, I'll be walking around here. If I want to go out, I'll be looking for my keys for like 1 hour. Sometimes I'm even holding the key in my hands, right? I'm not saying that it costs anything. I'm just saying that for me personally, sometimes I see that side affecting me. So then I'll tell myself it's time to stop. But I have used marijuana my whole life, even as a mental health professional. And I don't lie. Or, I know everybody who knows me know I'm a Rasta woman and I advocate for marijuana. So Raskwesi, that's my answer to your question. So I want more questions. You're welcome. Yes. More interaction. Ras David, I know, gave me a lot of some ideas. You gave me some materials. I haven't been able to look at them. The files were big, but come on now, let's interact. Tell me what's on your mind. Tell me what you're thinking.
Yeah, can you hear me now?
Yes.
Yes.
Okay. Yeah, I mean, I think about excuse me. I think about the fact that the trauma you talk about. It be real. I like how you keep on saying this is normal, right? Like the problems you were talking. You kept on saying is normal. The problem is when it gets out of hand, right? So anxiety is normal. Right, depression is normal. Great. I think there are two different streams of thought where some people hold it like, these are things that have to be, like say, stigmatized, taken away from us. You don't need these things. And then there's another stream that says, let's take it and intensify it. Right? If we want to come out of this, you can't pretend that you're not insane. You can't pretend that as an African you don't have ADHD in a world where there's a zillion things happening at the same time. It's just natural that you be interested in a zillion things at the same time. So these white people have a discourse that tries to categorize everything. I bet you tomorrow they'll name another mental health disease. They'll create another name and say this one is like this and that one is like this. But the whole world got messed up when Europe happened up on the world. Already they were doing, like insanity is the currency of the world, default position, right? So then there are people who've thought through it that way. And I'm sure you can relate, or maybe you're aware of some of these people. Like the other way talking about Fon, for instance. He was doing what you're doing, right? And he was talking about the fact that we have to accept that as the reality of the world, that we're all crazy. Nobody is sane, right? Especially Africa. Yeah, we're not we can't say we have mental health, you know? So let's take that and intensify to its logical conclusion, rather than try to find these kind of, ways of, they're fragmenting the problem and complicating it. So right now somebody will say, I'm depressed, but I'm not anxious. Oh, I'm manic depressive. Oh, I'm a this and that. Oh, I'm a combination of bipolar and then tomorrow they could name another one. And they could name another one just to confuse the people. They go, oh, we found out that this, man, it's a kind of state where we have to get past. We're in a kind of war with the world, Africa, right?
Mm-hmm.
And we have to think about it along those lines, that these things have to be intensified. We have to align our intentions, right? But we have to intensify rather than taking your foot off the pedal, because the conclusion to what our ancestors were feeling when they interacted with the white people, it wasn't like, how do we become sane on your terms? Maybe I'm saying a lot of things that don't seem connected, but what I'm trying to say, the sanity we seek will come through intensifying these so-called anxieties. I'm not the first to say, the other scholars have been working on this since the latter part of the 20th century, where people are saying, like Kojo Eshan, for instance, he elaborates on the idea that you shouldn't be running away from your anxiety and depression. If you think of yourself as you want to see drastic change in the world, you have to utilize, intensify. That's just one way of saying. There are other people who say, for instance, I know you've heard about acceleration and things like that of concepts, right? So that kind of trajectory, because it's a natural thing that we have. I'm sorry, I'm talking too long in this direction, but if you have something along those lines in relation to the state of Africa, of the world itself, but Africa in relation to the world, the trauma and the natural effect of insanity that we experience, not just us in isolation, but those that cause it too. And trying to make sense of nonsense, it won't lead anywhere. Am I open to many questions, or it's kind of straightforward?
No. Yeah, let me I have ADHD, so also I'm kind of like for ADHD, it's like some of the symptoms of ADHD is people interrupt, like you are quick to say what you want to say, right? So it's like I'm holding myself from interrupting you.
And I'm saying that's good. You see, that's what I'm saying. Yeah. These are things we have to intensify rather than trying to, I know we need orderliness, but in everyday interactions, the spontaneity, the messiness, being okay with uncertainty, being okay with what you can't predict, things like that. But it's getting about normal, it's tripping us up.
So, Ras, we say that you have to be okay with not being okay. Okay?
Yes.
So for mental health professionals, mental health and workers, we don't use words like you are insane or you are mad. When you are depressed or anxious, you're not insane. You're not mad, right? You're just like I said, it's a state of being sad or fear or worry. So people who are on the streets, like Accra Street, and they are wearing they are naked, walking on the street, or wearing tattered clothes. They're not functional. They haven't bathed for years. Their hair have locked up, and they're like us Rastas, they call us Yabodam because of why? Because the people on the streets look like us, mainly because of the locks. Correct. So, but those people have a mental health disorder, and some of those are schizophrenia and psychosis. Okay, those are psychosis. So we have a word for every name. So it's not, we are not insane. You are delusional. Like somebody would say, oh, like me, I'll say, if in a state of delusion, I'll say, oh, I'm the president of the United States, and I really, really believe it, that I'm the president of the United States. There's nothing you can tell me. I go about, like, hey, open the door for me because I'm the president, and it's not true. But in my delusion, that's what I'm believing. You're believing things that are not real. right? So those are the words. So we don't ascribe insane or those are words that create stigma. So you have to know the words and say, I'm depressed or I'm anxious.
Can I say something real quick?
Mm-hmm.
So what I'm saying is that's great for what you're doing, right? For your the job, the field, right? From your end.
Mm-hmm.
For me, I like to accept if you call me insane, and so what? Right? It's not a problem for me to be called insane because you're already calling us insane behind our backs. So it doesn't matter. I don't struggle with that. It's not a concern. Right? We don't have to be concerned what you're calling us, really. What we're looking for is something we're immersed in. But okay, so the point I'm trying to make is that you say schizophrenic here, right? Or schizophrenia over here. That too is a symptom. I mean, if you check out some of the Fanons that we're talking about, I'm sure you're aware that he talks about these symptoms as just symptoms of the people who are going through a colonial experience. No one is immune, right? Of course, I know what you're talking about is some people where they take off their clothes, they lose track, they're not, taking showers, they do whatever, they're living a certain way. Cool. It's a problem to be dealt with. But as we're talking about insanity, I think let's talk about where all of us affected by this concept. Because we're going to sing, oh, that guy's crazy, this guy's sick, and he went for treatment for 1 week, and this one's sick. And we overlook the fact that we as a people, and I'm not talking about using the terminology to go to the topic, right? Like what you're doing, the academic thing, right? It's not schizophrenia, it's depression. All of that I'm saying you're fragmenting the concept, right? Why we get to a place where accept that we are all, if we're going to borrow some of their terms, let's work with trauma. The situation of the Black in the world, right? It drags you out the normal, right? And that's how we've lived for centuries. So that's the culture, right?
Yeah.
Let's get past this idea of getting cozy about it. These are cozy terms that don't address the situation. Let's leave that alone. And let's talk in terms of this situation we're in now. What do you feel as a Rasta woman in this war, right? How do you feel beyond all the terms that they've given you? Away from that. Talk to us from the heart. We are all in this situation, right? In this situation. Let's leave out the people who are named and all that as patients, right? And let's look about us as African people.
Okay. So to normalize all these things, and truthfully, I'm speaking from my heart, and I'm not trying to be professional at all about this. I'm trying to normalize it for all of us, whereby I said we all feel sad, we all feel stress, and we all have anxiety, and it can be coming from any particular area of how we perceive a threat to our lives. So you can attach that to your life, whatever in your life that is stressing you, that is causing you. Now, when we come to us as Rastas, right? What are the stresses that we deal with? A lot of us have been disowned. When I started seeing Rastafari, a lot of my family members told me not to come to their house because I started growing dreadlocks. So at that time, that would do, girl, 17 years old. I had lost my dad, and my mom had traveled, and I was on my own. Even one of my aunties that I was staying with, she put me out. Right? So you would say that I'm homeless. But, Jah is more powerful. He gave me resources and I had places to stay. So what would that cause for me as a young woman who is growing dreadlocks, and they're telling me that don't come to my house again, and they are my family members? It will cause me depression. It will cause me anxiety. How many of us have not dealt with that kind of stuff as Rastas? There were times that in my classroom, Rasquasi, I had one of our teachers used to push me around because she just resented the fact that I had dreadlocks. She used to push me and bully me. And I had to go and report her to the vice chancellor, who listened to me. She sat down, she listened to me, and she told me she would address it. And I didn't hear anything of it, but that lady stopped treating me that way. Okay, so these are things we go through as Rastas. We get labeled. We get like, they don't want to employ you because you have dreadlocks, you have a beard. They want you to look a certain way, look prim and proper, look like a gentleman. So don't shave. They want you to shave your beard. They want you to shave your hair. And you are resisting that, right? So this is what and that it caused trauma for us. And that trauma caused us depression. It caused us anxiety. So that's why I say, if you feel like the resources that you have cannot meet your needs, you are a person, you want to get employment, or you want to even start your own business, but people will not talk to you, people will not do business with you because they think that you have that you don't look prim and proper. Ras Bureau is here. I acknowledge you. In the United States, there are a lot of children that were denied the opportunity to graduate, to walk on the stage. Why? Because they have dreadlocks. So it became national news.
Can I say one quick thing? I mean, Rastafari is the situation, right? But this can be heard for even people who know they live as Rasta because they're African, right? So I agree with you. Let's link it to that. And I'm just trying to think of it like, what are we? You have some things I would love to have you. I would love to hear you on, like. You're talking about personal cases, individual cases, and all that. You've illustrated it with a lot of that. Now, I'm just trying to say, can you look at it from the angle of the collective, Africa, the African situation, the Black situation in relation to the world? That's what's happening with us right now. That's the question we're dealing with. Yes.
Right. It's personal, and everybody in this room can relate to that. Who cannot relate to having dreadlocks? I'm not saying. No. I'm not denying so that's that. What. This is okay. African. We are African.
Can someone else join the conversation?
Right. Let me. We are African, and as Africans, we have post-traumatic stress disorder. That's how they have labeled our condition because of slavery, colonialism. And where does that come from? It comes from our skin color has been said that it's bad. So I do my teachings by telling you my personal experiences and experiences of people around us. And you can throw your experience in. That does not negate the fact that what I'm saying has traumatized us and it caused us to have depression and anxiety. Okay? Fear. Anxiety is fear. I have a little girl that was my client that told me that she feels ashamed. She doesn't like going to school because she feels that her skin color is like poop. Rash, that is pertaining to us. How would you feel if your little girl don't want to go to school because she feels that her skin color is like feces, poop? Okay? So these are the stresses and the trauma as Africans, as Rastas go through because our skin color is our trauma. Our appearances is our trauma. I'm talking about the beard. They won't employ you. They won't do business with you. They ridicule you because you have an appearance and that you have a beard. And you will not cut your beard to please anybody. So that causes you to have, you cannot function the way that society wants you to function. So that can cause you to have stress, to have anxiety, and to have fear, depression.
Can I quickly make a quick point here? If I understand what Seven is saying, I'm attempting to see if I understand what Seven is saying, though. But for Africans, for instance, I guess what we're saying is things have been defined, right, based on other people's experiences. So when you say, for instance, that someone is anxious, right? What are the things that go into determining that? Okay, and for Africans, if you say, for instance, that somebody is ADHD or whatever, right? And before these terms were coined, where were these people? Does it mean we have been dealing with this for centuries before anybody even gave it a name? If so, how were we dealing with it? And I believe that if we dig deeper, we can find some of those things, right? For instance, let's say you're those type of things. And those type of things. If I understand what Seven is saying, I think that's the direction he's he wants us to look at.
Simon, is that what you were saying?
In a sense, but this conversation, I don't want to be the only one talking. Honestly, I feel like I talk too much already. In a sense, but I'm trying to link it to the political liberation of our people as a collective, Black people on the planet. You're illustrating the problem. You're telling us what this was happening, this was happening, this was happening. This is what this means, right? You're illustrating it, and I'm just thinking for the Black. So what does it mean? Does it mean we all have to go look for psychiatric help? Yeah, psychiatric officers will be twofold. And it costs to do these things, and we don't have doctors in everywhere we're at, right? Why don't we accept that this is our status and take that to work something for ourselves and not walk away from it? You know what I mean? Yeah,
okay, so let's say within the African country. Go ahead.
For instance, I use my when I fall into trouble or things that will have to discourage me or maybe keep me anxious or vexed and those things, I use it to build up on new things, like make sure that I move out of it into a new life, a new movement. That is what I do. But you see, mental health basically is from not eating good food. Because the food them that have mucus, which give us excess mucus, when we eat them, we become, the excess mucus blocks certain parts of our, the way to, where the oxygen to flow smoothly through our body, through our system. So therefore, when you have a mental issue, that means there's not enough oxygen reaching the brain. So when you stop eating all those foods and eat electric food, which is what will keep you with no sickness, you can live without having all these things to worry you at all. Nothing that somebody can do that should worry you. Yes. Somebody say they will not give you work because you have to dress up well or you have to look like them. You just decide to create some work for yourself.
Yeah. So I agree with you, and that's what we teach people. So you're correct. Mental illness, depression, and anxiety, it comes from not having enough oxygen in your brain, right? And the fact that we are Africans doesn't mean we don't have brains. We are human. That's our anatomy. The mind, I said earlier, creates problems for us, right? So if you're not breathing enough, and the brother said if you're not eating proper food, you don't have oxygen traveling to your brain. So you have nutrition is part of us. That's why I mentioned earlier, we are holistic. So you are the spiritual, you are the nutrition, you are the physical, you are the mental. All of that plays a part in your mental well-being. So if you're not eating well, Ras 7, I cannot generalize it to everybody because every individual is different. That's why I said me in particular, when I smoke the herb, there are sometimes I see that I'm not functioning the way I should. Maybe the oxygen is not traveling to my brain because I smoked it too much. I will take a break. There are certain foods I'm not predisposed to. Sometimes meat don't go well for me. But some people, in this room, I'm sure some rascals believe, we shouldn't eat meat. So, but some people also would want to eat meat, and it's okay for their system. So you have to know what foods biologically is not agreeing with you and causes you to have certain symptoms of depression, symptoms of anxiety. Alcohol, I know. The brother can tell us some of the foods that don't work for us. I don't disagree with him. That's a very valid point. But I know that alcohol, for instance, can cause you to be depressed, can cause you to have anxiety because you're not having enough oxygen in your brain. And thank you, brother, this one is a fact. So for us Africans, if we want to say, how are we affected by this? I wanted to start this by saying that, we have 3 words that say, miraho. It is not a white man that taught us that we have emotions and mirahu, because mirahu means I'm sad. Media bobo, media metete. That means I'm feeling anxious, if I'm correct. right? So I earlier on, before I started, I wanted to say these things to make it, normalize it for Africans to know that we have these feelings, we have these sentiments, we have emotions, right? Everybody have emotions in this room. If grief happens, media rebel, so life happens to us. So I'm talking in general terms of what happens to us as people. And if you want to go to, colonialism and all those things, Rastas, when I was coming to do this, somebody said, hey, do Rastas have depression and things like that? Everybody sees Rastas as we're very self-sufficient people, right? Like the brother said, are you going to wait for somebody to give you employment when you know that I'm not going to cut my beard and I'm not going to cut my locks? Right? But some of us, I don't know how Rasriro was able to do it, get a job in as a professor and a teacher. Right? So for your mental health, you have to be your self-esteem, as I mentioned. As Rastas, if you want to say, how do we overcome the system of oppression and everything, you go with your mental health. I mean, your self-esteem and your confidence have to be high. You have to know who you are. You don't let people define you, but you define yourself. So if you go with your beard and you go with your locks and you want to go look for a job as a medical doctor, as a professor, as a nurse, whatever, you have your beard. There's a lot of people with beards here that are employed. So if you have self-esteem, nobody can turn you down unless you don't believe in yourself. Because when you're going for a job, you go for an interview. There are laws that prevent you from being discriminated against. So you have to know how to push yourself, right? As far as your mental health is concerned, your self-esteem, that Ras David is just going to sum the whole thing. As Africans, how do we navigate in this world where there's oppression and there are stigmas and there are things that affect us as Rastas? It is, first of all, awareness of who you are. And your self-esteem has to be high and your confidence has to be high and you know your value and what you have to bring to the table. When you are equipped with these things, you can't go wrong. You can't fail. And I always throw in my personal stories because they are very my experiences, my lived experiences, and they help. The first day I was going for a visa, I went to the United States Embassy. I was a student at Legon, and the person that interviewed me, I have my dreadlocks. I wore my African dress. So how I was preparing myself to go, my identity came. Okay, I want to show you that I'm an African. I believe myself. You're going to give me this visa because I'm an African empress. So I dressed that way. And when I came, the man asked me, how much you have in your bank account? And I showed him my bank statement. And he said, this is not enough money. And I said, well, this is not enough money. I said, don't compare cedis to dollars. You are comparing it's not enough money as to dollars. I don't live in the United States. I live in Ghana. In Ghana, we spend cedis. And this is enough money by Ghana standards for a student to have. The US, how do we carry ourselves, as you're asking me? Know yourself, know your value, express yourself, and that is how you win people. And that is how also for your mental health is the same thing. Your mind talks to you. Your mind is telling you things. Your mind can tell you you are inferior. Your mind can tell you that you don't belong. Your mind can tell you, right, as a man thinketh, so is he. So your mind can tell you those things. So if you listen to what your mind's saying without engaging in your own mind and refuting and challenging those thoughts, then you are going to be what your mind is telling you. If your mind says, well, I don't matter, look at everybody else is better than me, you're going to sit in your room and be depressed. But you're going to tell your mind that that's not true. I matter and I have something to give and this is what I have to give. And so if I understand your question, Ras, is how do we overcome that? Engage with your mind. Engage with your mind. Empower your mind. Empower yourself. And I know Rastas are strong in that domain, but sometimes we cannot go very strong. So that's why we're having this reasoning to see, how do we encourage yourself. Okay? Self-love, have love for yourself. Self-love means it's an active process of accepting yourself, accept yourself, encourage yourself, and care for yourself. How do we know that you have depression? When you can't do your personal hygiene, you get up, you don't bath, you don't wash your clothes, you don't brush your teeth, you haven't bathed for like 2 months. It's not normal. You have to know something is wrong. You don't want to go out smelling, right? So you don't want to not clean your house, and you don't. So if you get up and you feel like I don't feel like cleaning my house, I don't feel like bathing, I don't feel like eating, I don't feel like going to work. Those are signs that you are depressed. I'm sleeping a lot. I just want to sleep.
Yeah, don't get me wrong. Your stories, your personal stories really help, and you're doing a very good job. I was just trying to see if you can address those other questions, connected to them. I just want to put it out there. If anyone have any ideas, you can, vibe on along what Empress would give us in terms of how mental health, the question of mental health, plays into like what we can call today's liberation struggle. Like, what does it mean for our liberation? Anyone have ideas about and listening what she's saying? I'm talking politically now. Maybe we can use that term, so we can be, because on a personal level, I can have self-confidence and get what I want, right? And the assumption is that if I can do it, everybody should be able to do it. But that's not the case. But it's something that can happen on a conceptual level or on a political level as Black people. And I think maybe somebody have something to say on that.
On the political level, look at the example that His Majesty set for us as Africans. And it's the same thing I'm saying, right? I'm saying the same thing. Whether you find yourself politically, socially, individually, again, it goes to self-awareness, self-acceptance, and self-esteem. Imagine His Majesty didn't have self-awareness. Imagine His Majesty didn't have self-esteem. He would just have said, well, let the Italians come and take our country because, just like our other political leaders are doing. They will say, well, you know what? Oh, you are our masters. Come and rule us. Come and give us food. Come and give us this. But the consciousness of an African, whether individually or if you're a politician, is to know that, no, we are Africans. Right? We are Africans. That's the awareness that we are Africans. His Majesty has said that we Ethiopians declare ourselves of one race only, and that's the African race. And we will deliberate on every affair of the African. We will fight where the African is concerned. Right? And I did Google some speeches of His Majesty for mental health. And the only thing that came up was the race speech. We Africans shall fight if we find it necessary, for we know that we will win. We are confident in the victory of good over evil. What did I say? Underline the word confident. You have to be confident of who you are. You have to be aware of who you are.
I want to emphasize alongside that to fight in the victory of good over evil. All of that. Let's take those concepts along with that. African liberation, right? Confidence, yes, is the means, right? But have the concept of what you're fighting. Because I'm not fighting to get myself okay, right? Or you're fighting to get yourself okay. It doesn't change anything that affecting Africa, really. Because Leslie was working on that level. Whether we're moving in the world, we're going to affect the world, affect Africa's situation. So what I'm saying is that let's link what you're talking about to that. That's all I'm saying. Something out of this question. I'm not saying what you're saying. What you're saying has been so helpful. I'm sure we've all benefited. I've benefited a lot listening to you, and I appreciate you coming through, Empress. For real. And I'm just saying that. Can we just link it to this thing and deploy it? And I think you're okay with anybody being able to chip in. Anyone who has some ideas along those lines. how we can link it to Black liberation, because on an individual level, on the collective level, those who cannot do things, the vulnerable, those who cannot, easy to say, tell someone have self-confidence, but the concept is so remote for some people because of the circumstances. Think about Africa. What can happen on an African level, not on the individual African level? I'm not saying let's negate that, but let's link what you're saying to that. And I think, say, if anybody have any ideas, Charlie, let me talk about those things too. Let me join on to what Empress give us. She's given us a lot to work with,
Anyway, I also have a question from her. Anyway, yeah. Self.
Sorry?
Where I know anxiety, but my question is, all right, how can one heal himself by going through that?
Okay, thank you, brethren. I have to emphasize my take here is for individuals, because individuals, as from my experience, individuals have certain conditions that they are dealing with that they don't know where or how to deal with it. So this is for the purposes of that. It's for the individual people and your mental state. Okay. So anxiety, how do you resolve anxiety? If you have anxiety, you have to, first of all, like when I said awareness, you have to know what is the source of your anxiety. When you have anxiety, first of all, question yourself. Anxiety is here. What am I afraid of? What is the message attached to the anxiety? What is it telling me? If the message is that I'm afraid that I'll get fired from my job, for instance, right? So you're gonna examine that. You're gonna say, okay, why am I afraid that I'll get fired? Is it because I don't get to work on time? Is it? If you give me specifics, I can give you some specific. But if I'm dealing with it broadly, okay, you have to examine where is the source of your anxiety. Every mental health condition that we're talking about, stress, anxiety, and depression, there is a message attached to it. Okay, we said it's a feeling. There is a message. So if you feel that you're being anxious, ask yourself, what is the message of what am I fearful of? What am I worried about? And that is then number one. When you have an answer to that, that is awareness. So awareness will give you a solution. Now you have to challenge the thoughts in your head that is creating that dilemma for you. You have to question that. You have to challenge. Let's say my anxiety is that I have like a certain woman that when her kids go out, she's afraid for them out there because she lost a child when she was in her, she had lost a child before. So when her kids are out, she's afraid for them. She's afraid that they won't come home. Okay, so you have to question, why am I afraid that my kids won't come home? And then once you realize that, because maybe I've lost a child before, so now I'm anxious about that. Then now you have to engage your thoughts. You have to say, sometimes you have to use spirituality. You have to tap into your higher power. Sometimes you have to pray about it. If you feel like praying will make you feel better, you have to pray to protect them. You have to you have to find ways to calm yourself down. You have to say, my children, I can't keep them in the house 24/7. They have to go out. So how do you manage that? How do you manage to be okay with them being out there without having those thoughts, right? So you challenge those thoughts. You can't control what happens in life. So I don't know if I answer your question or you have a specific anxious thing that you want to tell me.
No, well, the line is breaking, so I lost a lot of your words. But I know a lot of people go through that, and sometimes me myself used to encourage a lot of people about what they go into. As you talk about in relationship like man and woman, and also jobs, and also, disqualify rasters to be in some. Yeah, but me myself, I encourage myself and do a lot of things without, without discourage of any ways, So I also encourage people about that. Whatever you are doing, just have the confidence to do it. But no.
Yeah. Your line is breaking a little. Yeah.
So that's why I'm asking self without therapy. Yeah.
Therapy.
So you
That
can
is
also,
therapy.
let us know. Yeah.
What you described is therapy. Encouraging, like, if you find that you are anxious, you can find somebody that you trust, that you feel that they will listen to you. So you can talk to them about what you're anxious about. Maybe they have some encouraging words for you. If not, you can read a book. You can read a book that has, some very encouraging stuff. You can listen to podcasts. That's what I do personally to encourage myself. I go on YouTube and I watch a lot of encouraging podcasts. You can also listen to music. Reggae music, Afro beats, they have a lot of positive. Yeah, they have a lot of positive. Yeah. And that's what we do for therapy. When people come, music therapy, when people, my patients, I tell them to go and listen to music. When you get up and you feel depressed and you feel anxious, put on the music. And I wanted to say, when the COVID-19 came and Ras Santino was doing Ras video on Facebook, was doing his music for your quarantine feed, or I forgot what he called it. I found it to be like, during COVID, we used to sit at home. We didn't have work. We were just at home 24/7. And that was the only thing that was keeping us going. I will remember that when I get up in the morning, I don't want to clean. I don't want to function. But as soon as Ras Santino comes on, the one song alone would just cheer me up. I'll get up and clean and do everything and function okay. So music is one thing about music. When it hits you, you feel no pain. So music can be therapy for depression, anxiety, and stress. So Ras, everything you said, that's how you treat these things. You encourage people, encourage your own self, okay? Encourage yourself. When you feel like you are having, we call it defeating thoughts. Your thoughts are defeating you. You're having negative thoughts. That's why we say what? Rastaman vibration is positive. So how are you going to vibrate higher and think positive? That's how you're going to overcome your anxiety and your stress. Do we have any more contributions? That's a great one.
Yes, I would like to thank you so much for your presentation. You made it clear that marijuana doesn't cause any mental illness, but I want to find out other way around. Does it help cure any mentally related ailments?
Okay. Does it cure? According to CNN, Sanjay Gupta, right? That's what I know broadly in the United States these days. And that's not exclusive to that, but they were determining that marijuana cures convulsion, epilepsy, some mental health disorders, and yeah, so it has a lot of diseases that it can cure. So I cannot go into the details. Raswiro is here. Maybe Raswiro has some information you can help. But yes, marijuana can cure a lot of diseases,
particularly mental health.
Okay, it's a cure. American journalists here that are medical doctors have done research on it. They have the oil. They were using the oil to medicate. They were treating a lot of illnesses, glaucoma, and so many. Okay, Ras. And like I said, some doctors prescribe it for you for depression and anxiety as well. Yes.
Okay. All right.
Yeah.
Wanted to know his relation to mental health in
Make I help
particular,
you,
so you're clear with that.
Yes. Yeah.
Make
Some
I help
Rasta.
you small,
Yeah. Help me, please. Help me.
Theo, ganja, it cure like ordinary. This oil you are talking about, I'm making some here. Some women have some almost cancerous, so big one on her thigh. That oil killed or healed that sore in 5 days. You know, dog bite my daughter. A dog beat my daughter. I didn't take her to veterinary or anybody for any injection. I just rubbed that oil on that place and that's it. So a friend of mine's daughter also had a same dog bite, and they said they went to hospital and they said she has to go and bring the dog that beat her before they can know how to treat her. So as they tell me that, I just send the oil some to them because I did make it myself my own way. So I just sent it to them, and they didn't go to the hospital again for the small child girl. So that is just like my own normal experience, but it can treat so many diseases, my brother. You know.
Yes, it can. And it's also for hair growth. A lot of my friends here that know that I'm a Rasta, they keep asking me for marijuana seeds for their hair to grow. So I myself, I'm looking for some to help my hair to grow.
This
yes, brother.
THC. Actually, let's start it in the scientific way that when you go to you use the endocannabinoid system, when you're talking about the endocannabinoid system, every human being, every living thing has the endocannabinoid system. And this is something which is in the ganja and it's also in human beings. You know, and that's the only plant which have something in it. Humans also have it in. We have the CB1 in our brain, and then the CBD2 in our nervous system, or one way or the other. I can't remember which one, but so it's a plant you can use in, like Dr. Sebi, who treats almost all diseases on earth, including mental disease. There's part of marijuana inside. His medicines that he gives to people, and also in the they say in the body there is something we call in the brain or inside the head there is something we call the blood-brain barrier. So blood does not enter the brain because it can carry contaminants into the brain. So in the blood-brain barrier, the only thing that can penetrate the blood-brain barrier to go and do anything inside the brain is THC, the tetrahydrocannabinol. You know, so it is a very useful. Dr. Russo said that it's a plant or it's a medicine you can prescribe to anybody, and without thinking about any worry, like say something else to do the person. You know, and the Queen of Victoria, he was treating the Queen Victoria with her menstrual condition called dysmenorrhea all through her life. She was using ganja.
Yeah. So yeah, I agree with you, brethren. And here there's this article that popped up, and it said therapeutic benefits could ease the suffering of millions of people with various sicknesses such as AIDS, cancer, glaucoma, multiple sclerosis, spinal cord injury, seizure disorder, chronic pain. Yeah, pain. The oil was used to administer for pain as well. You know, yeah. So anyway, great reasoning. Do we have any questions, any suggestions, any feedback?
Yes, Empress. Am I audible?
Yes, sir.
Yes, sir. You are.
Yes, Empress. My question is related to work psychology.
Okay.
So, for example, I want to ask this question relating to what I do.
Okay.
I am in an office that a lot is demanded of all of us in the office.
Mm-hmm.
And that office is such that you can't do mistake. Mistake shouldn't be part of why you are there. Mm-hmm. And so sometimes the fear of doing mistakes sometimes makes you lose focus and rather do more mistakes.
Mm-hmm.
So when the pressure is like that, as an officer on the beat, mm-hmm. what should be cycling? How should you cycle yourself? Knowing very well that the office you are working is linked to a higher office in Ghana, and you have to be on point. So how do you manage that?
Very good question. And that one. So number one, if you can change your work environment, which is to say, give your services to another environment that is not high stress like that, some of us cannot. If you can, that's the best remedy, right? Because you don't want them stressing you like that. But if you can't and you must work there, what you have to do, I would suggest review like your work before you get there. Like make sure you know your task. This is what I'm supposed to give, and this is what I'm going to give. So make sure you know all of that and show up on time, because sometimes when we are late, we are disorderly. I'm not saying that you're late, but if you're not on time, it can cause you to like fumble, and then you're trying to make up for the lost time, so you can mix things up, right? So make sure you show up on time. Make sure you know what you're supposed to do. Make sure that you know when to clock in and when to clock out, because sometimes they overwork you, they overstress you, and so stuff like that. And if it's possible, if your supervisor will listen when you go for like meetings, employee meetings, let them know how the structure, the culture of the establishment is affecting you, right? Brethren, do you think they listen to you? Are you able to talk to them?
Yes, I there's something that I've noticed.
Mm-hmm.
Since I told them that I'm a Rastafarian,
mm-hmm.
the expectation on me has become higher, mm-hmm. because they see Rastas, as people who with high intelligence.
Mm-hmm. Mm-hmm.
So, because of that notion, mm-hmm. the pressure on you to also prove yourself is very high.
Mm-hmm. Mm-hmm.
So, mm-hmm. when the thinking is like that, like you said, mm-hmm. you still have to find a way of, going through it.
Mm-hmm.
A little bit.
So if you have to find a way to go through it, right, I would suggest that you sit down with your immediate supervisor and let them know, especially if you notice that the expectation for you is different from the expectation of others, and they are pushing you above your limits. It's not realistic, and you are not able to meet that. You have to let them know and, have a rational, respectful conversation with them and see if they will listen to you.
Okay.
Can I contribute? Quickly?
Yes.
Okay. So I don't know if we are also familiar with this concept called mindfulness, right?
Yes.
Now, mm-hmm. mindfulness is something that they push a lot in the, mm-hmm. I believe, in the mental health, branch mm-hmm. as well. But I like to speak about mindfulness not as a concept that was introduced to us to be studied, but as I said, as something that we've already always dealt with, right? They call you at dawn and advise you, right? They tell you things that you carry with you for the rest of your life. They are mm-hmm. drawing you on. That's mindfulness. These things, mm-hmm. brethren, if you have, and I know exactly what you're saying, you can be working in a place where the stress is like high, where one small mistake would mean a whole lot. Some of us work in industries where they are very lawsuit prone. So you cannot afford to make mistakes at all. But the mindfulness helps a lot. It's a whole thing. I don't want to take up the time. Later on, maybe I can develop a lecture on mindfulness, or maybe if you see me, we can talk about it. But mindfulness, I sum it up to me. Say, when I sit at my desk, for instance, to work, I have a job where some people that you are trying to help may not even be able to see that you are helping them, and they cuss you out instead. I don't know what I even do for that. What I would do is, the moment I sit at my desk, I tell myself, I am bigger than anything that I'm going to face today. I am here to help people. I am not here to harm anybody. Anything that comes at me, I'm going to deal with it to the best of my ability. You can frame this thing in your own way, but anything that you have in your head that makes you believe that you are bigger than anything that is going to come at you that day, you tell yourself, you reassure yourself, and then you step out to do it with the mindset that I'm here to help people. It depends on what industry you are helping in, but you are working in. But in my industry, for instance, I know that I'm helping people, even though I'm getting paid, right? I could be doing something else. But so I always tell myself that mindfulness is very helpful, I'm telling you. I learned this thing and I've applied it, and it's worked, it's helped. Every time I'm pushed by a client, customer, whatever, and I feel like I should tell them my peace of mind. I tell them, you know what, go wait there, go do your thing there. You understand? But then I catch myself just in time, and I tell myself, you know what, I'm bigger than this situation right now, and I'm going to ride above that situation. So that's just a little contribution I want to put in. The mindfulness, it's very important. And the mindfulness thing, say you are completely in control of your mind and how it functions, right? This is purely a mental health thing. If most people who are dealing with some of these things that Empress have enumerated are directed towards mindfulness, they can defeat half of those problems before they even go through any medication or whatever, right? Because basically it's telling you that if I'm dealing with bipolar, for instance, whereby when the energy comes, I'm doing all kinds of things. We have some examples in Ghana where we have had people go on live, live Facebook and take ridiculous stuff. But if you can catch yourself in that moment, then maybe you will not switch on that camera, So mindfulness is a big thing, brother. Give thanks.
Barry, you can also contact me, and I can work with you and give you some. I'll give you a lot of strategies. Rasmiro.
Yes, I am. For that. I'm really grateful for the contribution from our brother.
Rasmiro. I think
Rasmiro
wants to say something. Yeah.
Okay, Ras, go ahead, please.
Oh, if you have something to say, please go ahead. I'll go after you, please. Okay. I'll go ahead.
I've taken in. Okay, should I go?
Yeah, please go ahead.
All right. So, the feedback that I've taken, I think it will help. But, Empress, do you feel that maybe is the passion I have for the job is because in my mind I have cycled my mind to mean that this is the kind of job I love doing. So because I've cycled my mind that way, even if I'm working and I'm tired, I don't notice it unless I come home before I feel that I'm tired. In the in the chain of that, between me cycling my mind that this is the job I love so much, and realizing that I am overworking within that chain, how do I do my mind? How do I program my mind within that chain?
Yes, sir. Okay, so that's a very good question. Yes, I answer your question to say yes, because you love the job so much and you have so much passion. You are overworking yourself, right? So that's what we call workaholism, right? You are being a workaholic, and you are not taking care of yourself. So realistically, you have to chew what you can bite what you can chew. So you have to be aware. How you can psych yourself is to tell yourself, maybe your work hours is 9 to 5, and I'm only going to work 9 to 5. I won't go overboard. Okay, Ras, if you think that will work, you can say, okay, 9 to 5. Mm-hmm.
Yeah. So it will work. So what is it? So please go ahead. I'm listening.
Yeah. So there's something we call boundaries, and like Ras said, mindfulness and boundaries, they go hand in hand, right? So mindfulness is the practice of being aware of and paying attention to the present moment without judgment. So you have to be aware that I like to work too much, and as I'm working too much, it's affecting XYZ. So you can know what it's affecting, and because you don't want it to affect that, you have to set boundaries. Boundaries means you have to create some limitations or some you have to protect yourself. You understand what I'm saying? Protect yourself. Set boundaries. Set boundaries means sometimes, because we love the job a lot, anything they say do, you'll be like yes. You'll be a yes man doing everything because I love the job and I want to prove that I can do it. So anything can you come tomorrow? Tomorrow is Saturday. You want to go to the concert, but because you love the job too much, you will say no, I won't go to the concert. I'm going to the work. And so you have to set boundaries to say no. Now I need to rest. Maybe I need to sleep. Maybe I need to go visit a friend. Maybe those things are important for our mental health. So don't neglect everything and just put everything into work. So that's where you have to set boundaries, limitations, and just say I can realistically work 5 hours, 10 hours, 20 hours, and I'm done. You have to determine that. Okay? And like I said, you can contact me and we can talk more strategies because we don't have enough time.
Yeah, man. Give thanks. I give thanks. Thank you so much. Give thanks.
Okay. Mm-hmm.
Yes, can I hear me?
Mm-hmm.
Yes,
Well, give thanks. First of all, I want to say, Sister Sadia, thank you so much for your presentation and for the words that you've shared and for the insights that you've given. I'm sorry I had to be dealing with a situation at home, so I came in a little late. I have to get some things, fixed around the house. So I apologize for that. But I appreciate, what you've given us to think about. And specifically, I like the fact that you brought in the speech of His Imperial Majesty Emperor Haile Selassie I I, which Bob Marley, configured into the song War. And I want to, touch up a little bit on that. So, the first line says, until the philosophy which holds one race superior and another inferior. So I consider, and you can correct me if I'm wrong, but the feeling of inferiority as a mental state as well. That is, inferiority complex is something that is also menticide, right? Committing mental suicide, right? Because of this inferiority complex that has been imposed upon us. I was back home 2 years ago, and I got some books that kids are using in schools and JHS and stuff like that. Sitting down reading these books, at least two of them, have listed the benefits of colonialism. Now, just imagine, I have the books right here. You're telling our young people that colonialism, the act of one country coming to dominate another country, dominating that country mentally, dominating that country politically, dominating that country economically, dominating that country spiritually, dominating that country by way of exploitation of its resources, has advantages. And kids are going to grow up thinking that, and that this is something that if you even check our newspapers and our news websites, subtly is always presented the white man is here to help us. I remember also back in the day, I don't know if this is still happening, but the last page of Ghanaian Times, they always had a thing where they were showing how we are being helped by these Europeans, to the extent that even if a European came and built something like a KVIP, they put it in newspaper. This is what I call the act of creating a situation where one race feels or becomes inferior. It is something that is imposed upon, and that is also a state that we as African people are in today, I would say. And His Majesty says that we have to permanently discredit that and abandon that. Now, he also ties this into our human rights. It is our human right to feel human, to act human, to articulate our ideas as human, as opposed to a feeling of inferiority. And if this is not equally guaranteed to all, he says, then there is going to be war in this world. Now, he also ties this whole thing of this superiority, inferiority situation. And we know the race that, because a lot of people, when they take this speech into consideration, it's one of the most, I would say, abused speeches when it comes to His Majesty's speeches. But His Majesty, when he gave this speech, he gave it in California, 1968, speaking to mostly Europeans. And he says that this is also tied into the rule of international morality. So when we talk about international morality, we're also thinking, how has international morality been espoused by we as Africans, or how has the lack of international morality impacted our mental functioning as African people? And His Majesty says that we need to attain that. Now, when we go down the line, he says that we Africans will fight. We find it necessary. So here, my interpretation of that is that in order for us to overcome this mental condition in which we find ourselves, this mental condition that has remained with us from colonialism through neocolonialism, we are going to have to engage in a fight on the political level, a fight on the spiritual level, a fight on the economic level, a fight on the educational level, and all other levels, in order to be able to overcome that. And that is when we know we shall win. It is that knowledge that brings about the confidence that His Majesty is talking about, the confidence in the victory of good over evil. So I'm so glad that you brought this, this speech up, because I think that if we study the speech, we can be able to see that His Majesty was addressing the Europeans, but he was also articulating the condition of the African and what the African had to do to overcome this mental inferiority complex that we have been bequeathed with as a result of the colonial enterprise. So I give thanks for the words, and I think that by you sharing that that speech brought into mind contrast between the race that feels superior and how they've continuously imposed upon us a feeling of inferiority. And this feeling of inferiority is coming through our churches, where we have, a white guard. You're telling the people about that, right? It's coming through our politics, what we're putting on the TV. Kumkum Bajia. You go to another country and you take their soap opera, and you come and you superimpose Cree lyrics onto that. What are you telling the people? That we cannot create our own soap opera? That is a form of inferiority complex. Again, if you put it into our kids' textbook, for instance, that colonialism was something that came to help us. That is, creating a form of inferiority complex. All these things lead to low self-esteem. Low self-esteem is a form of mental it's a form of mental illness. So, and it's very use a certain word, which I'm going to repeat here. It says you're creating subhuman bondage. So years after they've politically, quote unquote, left, we are still in this subhuman bondage. And we're going to have to fight, on all levels to be able to overcome this evil. And that's why His Majesty also concluded by saying that we are confident in the victory of good over evil. So give thanks for the words, give thanks for the vibes, give thanks for the education, give thanks for all the contributions. I'm learning a lot, so bless it.
Can I make a quick addition, please? First of all, Prof. Blessed Ed Strong, Prof. Wiro, Prof. Kodjo. Yes, and I'm very blessed to have the man, an inspiration to most of I&I. And we just call for nothing but the very best for the eye on your Ed Strong, So enough thanks. And then secondly, the point you just made, Rasta, it's a very, very, very deep point. And some of these things, apart from, even the language that we use, and man like Seven, we talk about language a lot. So Seven, here's one for you. You hear the music that we produce for a very long time. First of all, they say High Life is our national music. Where from that? High Life. And if you go into the roots of it, High Life came out of European expatriates. That's basically what it is. But we've embraced that as our national music, our national heritage. That's problematic. And then if you go into the High Life itself, you hear words like Mibroni, right? Mibroni, how many songs haven't you heard with that expression, Mibroni? So if you say Mibroni, then you hear that the broni is being placed above the bibini, because the Mibroni is supposed to be somebody who's special to you, right? That's problematic. But then we also see a reversal of that at some point, which we all have to help to amplify. Because you hear people like Amachi Dede also using words like that to counter that narrative. So when we talk about mental slavery, as the angle that was highlighted right now by Prof, I just wanted to add that it's something that we have to be constant aware of. Yes, I'm stupid. Sign, and then we will laugh at that, thinking it's a joke. No, it's not a joke. It is it's like embedded in our brain, and we need to flush that out. Give thanks.
And our children are absorbing that. And in my immediate environment, I have seen it. I'm saying a lot of African American children come to me for therapy based on the identity of their skin, the way they look, their lips. It's so sad. And I'll emphasize, a little girl came to tell me she feels ashamed of her skin because she feels like her skin color is like poop. Anyway, so now as Rastas, what do we do? Since Ras Wiro, you highlighted on His Majesty's speech, and it highlights on, inferiority, which is a very good point. So that's why I was raising that issue to say that for our mental health, every Rasta should challenge any sense of inferiority. It's in your own mind, right? If we ever feel any sense of inferiority, it can happen to the best of us. There are times that you wake up and you are not at your best, and you are faced with a circumstance, maybe stress, maybe it can be work. Maybe you're feeling like, oh, my boss knows too much, and my boss is up here and I'm low here, and or my job is paying me, and they own me. No, that's why I teach people that come to me for work issues. They don't pay you, they don't own you. You know what? You are an expert, and you are giving them your expertise. Okay, you went to school, you invested in yourself, or you went to gain a skill, you trained for a skill, or you know a skill, you acquired a skill, maybe it's God-given, and you have a talent. You are giving them that talent. So you are selling it to them, and they are compensating you for it. So they don't own you. You don't have to feel inferior. If your boss insults you and slap you, you say, yes, master, and you are coming. You have to feel good about yourself enough to respectfully address the issue when it comes to superiors at work. That's where some of our mental health challenges come the most, and inferiority. You know, your boss will tell you, you know, come to work at 6 a.m., but you're supposed to report at 8. Are you paying me? To me, I tell the people that I work with in those kind of areas that have challenges like that, you have to ask the boss if you're paying me to come at 6 a.m. And if you're paying me, that is my time. That is not officially what is on my clock hours. So if you're going to pay me, then I have to decide whether I accept it. Am I going to take the money and come at that time, or am I going to say, no, I am coming at 8 because officially that is my start point. So, but when we feel inferior, we cannot defend ourselves. And when I say defend ourselves, I'm not saying we should be combative, rude, but you can advocate for yourself in a very professional, respectful manner where you're heard, your voice will be heard. And in organizations, there are chain of commands, there are human resources where you can address your concerns. You know, sometimes our bosses can be unreasonable. And I learned leadership. We have bipolar leaders. We have leaders who have mental health issues also, and they bring it into the work and they cause trauma for workers. So sometimes don't be afraid to address the issue. And we have to know that we are not inferior. His Majesty has already told us. So that is on the individual level. And then on the national level, we advocate. We are singing our songs and we are telling people, you know, about Africa and how, you know, Africa should rise up and all of that. So give thanks to Aspiro. That's a very good point. But so the two things here is inferiority when it comes to the generalized Rasta sense of our mental health. We have to realize that inferiority can impact us where we don't feel valued and our self-esteem can go down. So we have to know we are not inferior and we have value. We have something to give. And for that reason, that would improve your sense of worth and your self-esteem and your confidence for you to function, right? Without the depression and anxiety. If you're able to build your confidence, you can meet some of your depression.
Give thanks.
So, yes.
Okay.
Yes, restroom. Yes.
Now somebody will answer your question.
Greetings.
Greetings, Queen.
It's been a long time. How are you?
Yes. It's been a long time. I'm doing well, Empress. Yes.
Very good. I so appreciate love your presentation. I was kind of listening from another room, but everything was solid. I do have a question though. And I'm sure you're familiar with, I would say research that's about 10 or more years old that talks about epigenetics and the way children inherit the trauma that their parents experienced and their grandparents experienced without knowing that they inherited. So you gave the beautiful example of the mom who's nervous to send her child out because she has lost a child before, and this caused her anxiety. But what we see in people who have historic traumas is that they will be nervous when there's nothing nerve-inducing in the environment. And they don't know where it is coming from. And it's intergenerational because they have inherited it. And I think that find is that Western psychology address the needs of the African people.
Brother need to mute. Brother mute yourself because
the honorable come. The honorable. Instead by Coca-Cola, my table meeting by never meeting. Oh, nice one. Nice one.
Son of man. Hello, son of man. Please.
All right. So I was just saying that it's like another voice in the back.
We are having some feedback.
I was just saying that Western psychology ends up being inadequate because it only looks at what is visible, what is here, what might be causing the problem, but you may have inherited it. And I see African psychology as being optimal because it involves the use of divination. And when a client comes before a practitioner, the practitioner traditionally had the ability to look at the patterns that you come with, even when you're not aware of that. And I wonder if you might say a word on that about how what the Western world has offered us is good, but it ends up being inadequate to fully address not only trauma, but just the full scope of the African humanity. There are things that we have that we did not live through, we did not personally experience, but they are with us because it is in our family line, and it can be causing disruption in our lives.
Give thanks, and Empress Afantua. As a Rasta woman, I always give credence to our African philosophies and African everything. That comes first. I haven't had the opportunity to study African psychology per se, right? But if it comes to, I said that for your mental health, it is holistic. It's coming spiritual. So for us, as a practitioner in the Western world here, we are looking at your mental health holistically. We are looking at it from your spiritual, your environmental, your emotional, and everything else. But the most significantly, if I would quote Sigmund Freud, right? He said that our adult pathologies come from our childhood experiences and our childhood trauma. Okay, so when we have an opportunity to address somebody as a patient, we don't just look at the surface. Sometimes the patient tells you why. They know why, but sometimes they don't know. So for me as a clinician, I will take you back. I will interview you and assess you all the way from your childhood. I would ask you to tell me about your childhood experiences, your historical, your family history, your place of origin. All of that will inform me that, this trauma or this, whatever you are experiencing came from this, so on and so forth. Sometimes you will have, somebody will say, I have a certain behavior that is this and that. Then we don't know where the behavior came from. But what kind of childhood experiences did you have? My parents used to fight a lot. You understand me, Empress? Like you would say, oh, my parents used to fight a lot, or this and that happened, then the causes is coming from your childhood. It's originating, or when we're talking about schizophrenia, for instance, right? Schizophrenia is a very, very, very delicate one. That is where people are hearing voices that are not there. You and I cannot hear the voices, but they alone are hearing the voices. Then they have people that see things that are not there. So when you are in a room with them, they're seeing things, they're talking to spirits. They tell you that they are talking to spirits. Do you know, I don't dismiss that to say that, like somebody say you are mad, you're crazy. I would say, especially if they're African American, I would tell them, maybe your ancestors are trying to communicate with you. Empress, am I making sense?
Yes.
Yeah, so I would tell you that maybe your ancestors, I would not dismiss that. It may be coming from a spiritual angle. But in America, you have to be very careful. If the person is aligning with what you're saying, then you can go further. So you may say that, as a person from African American descent, we were forcibly removed and prevented from practicing our culture. So there was Nana, the priestess on the Akunadi shrine, right? Mm-hmm. She was dealing with certain clients, certain people that had a mental issue like schizophrenia. They would hear voices, delusional behaviors and stuff like that. And then they had to trace back to the Akunadi shrine to determine that her ancestors from there were calling her to practice, right? The priesthood. And when they run away from that, then they get those kind of issues, right? So once they agree to serve the shrine, then they can perform certain rituals, and then they'll be okay. So yes, that there is a place in that in psychology here, and we address that. And so that will also address some of the things that Ras David was saying. How does these things pertain to our African philosophies? So our African philosophies, again, going back to the shrine, we may have somebody behaving in a bizarre way, right? Behaving in a bizarre way. They are behaving in ways that science cannot explain. We have tried everything within a mental health field. We have given them every medication. We have done every psychotherapy, but it's still not working. They are being disturbed, right? Even in Africa. So then spiritually, they will have to do the divination that you are talking about, Empress. And then they find out that, your shrine, you have a shrine in your house and you are in line of succession. And if you don't go and serve the shrine, they will make you mad. That's the delusional. You have psychosis, so sometimes people can trace it back. And because of, like Rasbiro was saying, because of colonialism and inferiority complex and the white man way of being superior, we have neglected those things about our African aspects of, religion. So a lot of us, we don't want to be herbalists anymore. We don't want to go serve the shrines anymore. And so the shrines also have a way of attacking us because they want you to come back home. So Empress, that's my take on that. I don't know if I answered your question.
Yes, give thanks. I appreciate it.
Yes. So there's a place for spirituality. Sometimes when something is happening to you, you think it's a mental health. You have to delve into the origin of it. It might be a spiritual thing, and you yourself can tap into that and resolve it that way. Your therapist can help you, or your family can help you.
Yes, I give thanks.
You're welcome, Empress.
Yeah.
If Daddy Bosco is here, I haven't heard your take. Anything you have to say? All these contributions are very helpful.
Before Daddy Bosco come in, please, let's all say happy birthday or happy solar returns to Professor Kwadio Oruwadie or Professor Wiro. Happy birthday, my lord.
You are late. You come back around.
I never know that you put you on the spot. So give thanks. President Kex and Empire, everybody give thanks. Rastafari.
Yeah. But I think you guys are being biased here because it was my birthday too.
Wow.
2 days ago.
Happy belated.
We're not here today. Okay, happy belated. How about that?
Happy birthday.
Yeah.
It's happy birthday to
no life and no regrets for all of you, Yes.
Yeah. It's President Kex in the house.
He was a minute ago.
They talk. It be me.
Oh, okay. I didn't know that. So,
congratulations to.
Thank you for one who said that.
Kex speaking because Kex was my neighbor, so I have to acknowledge that. I used to live next door to Kex, right next door.
True.
That's true, man.
Yep. So the moderators, how are we doing? I can sit here all day, but it's kind of we have to flow.
Ras David too, you like this, they become like a ghost. We always see you and pass you. The long
Rastafari.
last year.
Yes. I think we have been reasoning for almost 2.5 hours now. Empress has taken most of our answers. So I believe it's apt if we wrap up now. So I will go over to Empress to give us a closing remarks. But before that, I wanted to take the opportunity to ask the final question. Empress, would you say cannabis is useful or marijuana is useful in tackling stress, depression? I listened to one lecture by Professor Carl Hart where he said cannabis releases what they call endorphins. And these endorphins are feel good. It makes a person feel good. And like you are saying, if you are able to change your mindset about any situation you find yourself in, it helps you in dealing with stress and anxiety. So would you say cannabis or marijuana is useful in tackling stress, anxiety, or depression? After the question, please, you can give us your closing remarks. Thank you.
Thank you for the question. So from a professional, as a psychologist, mental health professional, I don't have the resources to back that, and my profession here does not allow me to back that, right? However, on the Rastafari forum purposes, right, I would say yes. I have read a lot of scientific papers, and I've read a lot of books about the efficacy and the medicinal properties of marijuana, right? So yes, it does. It can help. Those who use it, the evidence is in the person who is using it. And Rastas are, in ourselves, we are very rebellious. We are rebellious because we go against the system. We're not going to conform to a system that oppresses us when we know that we are speaking the truth. And I wanted to say when I started also that if you take the life of Peter Tosh, right? Peter Tosh is one very strong advocate for the use of marijuana, where he was attacked. His life was at stake so many times for advocating for marijuana, right? And the Rasta man has been advocating for the use of marijuana since time immemorial. But what we have now, the Western powers have taken that mandate from us. Like I said earlier, they had series on CNN where Sanjay Kumta was over there, endorsing him and another doctor. I don't remember his name. They were there. They were endorsing like the medicinal uses of marijuana, right? So now the common practice in the United States is that every corner has a smoke shop. They call the shaman spot, where they sell. Now they're selling marijuana. They're growing. The white people are now growing it and selling it. And they don't have the CBD. They don't have, they are using all kinds of means to now make profit and money out of it. What I know is that certain states in the United States have legalized it. And if you can go to your doctor and tell your doctor that I'm depressed and this and that, and I want to use marijuana, your doctor will prescribe it to you and you have a marijuana card. You can grow it and you can use it, because I'm saying all of that to say, yes, the evidence is now coming out, to suggest that, yes, marijuana is medicinal. As a Rasta man or woman, you have to determine when you smoke it, or if you are depressed and you use it, how does it make you feel? Do you think that it heals you? Do you think that it brings you some joy? Do you think that it takes away your depression or your anxiety, or it minimizes your stress? Right, you understand me? You, the individual, have to determine that, because you are the one using it. Correct?
Yes, Empress, give thanks for that response. Yes.
Yes. Yes, there is the science medical doctors have written books and stuff to suggest, yes, it can help you with anxiety, depression. But just because you take it and it helps you with anxiety doesn't mean that if I take it and it's not helping me, then by force I should take it. If it's not helping me, then I have to find something else. But if it's helping you, by all means, go for it. So to sum up, I began by saying that the Most High that created us all holistic, which means we are humans who have mental, emotional, physical, spiritual, nutritional, everything to make us a holistic person. If one aspect is missing, it will affect the other. And it usually affects us physically and also mentally. And the mental can also affect the emotion. So we all have emotions. We have emotions such as sadness. We have emotions such as worry or fear. We have emotions such as anger. We have all sorts of emotions, right? So whenever for our mental health, usually it is what we are thinking and our perception of a threat. You are perceiving that something is a threat to your well-being. It can cause you to have stress, depression, or anxiety. And therefore, if you have any stressor, that's what we call the underlying stressor. When you come for treatment, we would look at what is the underlying stressor. What have you perceived to be a threat to you that is causing you to have an emotion such as sadness or depression? Now, when we look at that and we determine what the stressor is, or you yourself, you examine yourself, you have a conversation with yourself and you say, well, I'm stressed, or I'm tired, or I'm sad because I lost somebody, or I'm sad because, whatever the reason is. Now you can do therapy for yourself. The therapy for yourself that you can do is you can go into your mind and you can challenge any negative thoughts that you are thinking. If the thought is that, I'm inferior, you can challenge that and tell yourself why you're not inferior. You can examine your whole life and bring out reasons why you are worthy, you have value to this life. You have a purpose, and this is my purpose, and I have value. And that will you have to take care of yourself to elevate your mood or your mental state, right? To challenge your negative thinking. So they say what? Rastaman vibration is positive. So you have to vibrate on a positive note to promote your mental health so that you have no fear. Well, Bob Marley's song just came to me. Have no fear, have no sorrow. Something that is going, I don't know the song, but So Bob Marley said that have no fear, have no sorrow. Rastaman vibration is positive. So go within your inner vibration and then have reasons to challenge negativity so that you can vibrate and think positive and think high and promote your own self-esteem, promote your own sense of worth. My closing word is you must always ask yourself, what is my purpose in this life? What is my purpose? And am I living my life in alignment to my purpose? If you are not living in alignment to your purpose, you can have depression, anxiety, and stress. So make sure that you go in alignment to your own purpose. If you were not called to be a medical doctor and you were called to be a carpenter, or vice versa, maybe you were called to be a medical doctor, but you are running away from that and you are saying, I want to be a carpenter. It's going to cause you stress. You are not in alignment of your purpose. So find out what your purpose is and then live your life according to that. And I believe that when you are living in alignment to that, the Most High God will bring you the resources to make it happen, to manifest. With these few words, I give thanks. And if you have any questions about your mental health, to promote your mental health, to elevate yourself, think positive, vibrate higher, you can contact me later and we will reason about it. Thank you.
Yes.
Yes, sorry.
Yes,
Empress. As I shared the knowledge you have shared with us tonight. We've learned a lot, and we appreciate that. I believe, and you have another opportunity to also lead another reasoning on maybe a similar topic, because it looks like brethren were very much interested in this topic, and the numbers and the feedback shows that. And so maybe another time you may have to take us through another such topic. My lords and empresses, we appreciate, appreciate your leadership, Jonah. We appreciate the fact that you'll be sharing this on the YouTube channels. I can share our page, encourage people, those who couldn't participate, to also have a look at it so that they can also get the knowledge that we got tonight. Please, next reasoning topic will be led by Professor Aimotep Alagidede, and the topic is the Meta School of Manifestation, an overview. I would like to also let our presenters know that there are 2 slots for December that we haven't earmarked any presenter yet. So if some of us will volunteer for the December series or reasoning, we'll be grateful. With that being said, Empress, once again, we thank you very much. Daddy Bosco is here and he never said anything. I think it is worthwhile that we hear his voice in closing, or he has left already. Okay. Seems he has left already. So the time is fast spent. Professor Guiro, our 7th side, Son of Man, Jah Beloved, we give thanks for the mighty works. President Kex, Michael Kluger, Russell Jonah, everyone, we give thanks for all that you have put together to make tonight's reason and a success. So please, we'll meet again next 2 weeks for the next reason. We appreciate it.
Mm-hmm.
A lot.
Thanks.
Give thanks and pray.
Yes, bless. Yeah, I appreciate it.